Much of our research has to do with technology-based assessment and interventions with a number of different populations. One of the populations and areas of focus in much of our research is heavy drinking young adults. I'm going to be presenting some of that work, and we feel that technology-based assessment and interventions has potential for individuals in rural populations as well, but one just needs to take time and effort and make sure that those interventions and technology-based assessment is well suited to folks from rural areas as well. So I'm also going to be presenting on some formative research we're doing with two students to lay the groundwork for a web-based intervention for tobacco cessation for individuals living in rural areas. Well, in addition to the fact that technology has, again, potential for folks in rural populations, but whenever one works in a specific population, you want to speak to members of that population and make sure what you're bringing to the table in terms of your ideas and expertise is what those folks need and want, and it's well suited to them. So I had mentioned the tobacco cessation project for folks in rural areas. We're also doing an HIV preventive intervention that's amenable both to folks in rural and more populated areas, but we're talking with members of the study population there as well, and putting our initial versions of the intervention in their hands and getting their feedback. So the importance of getting feedback from whoever you're targeting with the intervention, I think, is really important.